Hey, this is Tom Judd speaking with Rossana Rivas from Peru. And Rossana, tell us about yourself and about clinical engineering in Peru.
Well, it started in 2006. The approach in that moment was certainly in the beginning, and the engagement was directly with hospitals, public sector in hospitals and some institutes. Certainly, among the years, the work was more and more involved in health technology management and clinical engineering from the approach of making decisions based on knowledge. Talking about Peru, we have a lot of achievements. Certainly, most of them are in the private sector, but we used to think that this progress will be positive and sustained on the next years. Actually, currently we have been doing several very good outputs in telehealth, telemedicine, primary level healthcare services are now under the scope of Ministry of Health, and we are supporting them not just for regulation and policies, but also to introduce the clinical engineering approach in the management of these health services.
That's wonderful. Now, I know you've had a role, you're as a professor in your own country, but really rallying people from around Latin America around HTM, both with the University of Vermont WHO Collaborating Center and Toby Clark. You guys have been doing training all over Latin America, but you've also been rallying them around telehealth and other emerging issues. Can you talk about that a little bit?
Certainly, yes. Through the Collaborating Center, we have been doing a network, not just with Latin America and the Caribbean, but also with countries like China, Bangladesh, recently, Ecuador, which is also in the Latin America scope. But the idea is to support among these continents the best possible approach to HTM and clinical engineering. Recently in COVID, but before in this context of low setting incomes, which is a very interesting point, not just to discuss and to approach the knowledge, but to know how to manage the knowledge, how to achieve access the best practices, discuss about it, and have a way to make an adoption and adaptation in the correct way to their own context.
Rossana, I know you've been a leader in the region of the Americas. And, one thing we did after Rome is we brought the regions together and we started talking about the regions talking to one another and sharing best practices. And I know you've already alluded to that, but hey, every month this year in 2020, there's been a regional meeting in the Americas. And I know you've been one of the prime movers behind that. The latest being perhaps in Colombia, where they talked about a lot of innovation. What are some of your thoughts on how those regional meetings are going?
First of all, I would like very much to congratulate all the outstanding leadership and guidance. You, Yadin David, Elliot, and all the team from CED, IFMBE are doing a great work, not just to select the topics, but also to engage in successfully the network among the world. Topics like the oxygen, telehealth, regulation, policies, health technology management were all certainly not just pertinent, but also they are not from just the perspective of the research academic, which is very important. I am professor, but that is not the point. The point is how to be able to manage all the knowledge from a diversity of perspectives in the correct way to give solutions. And I believe very much that this number of webinars are doing a great job in that direction. Of course, this is not, we have not just enough time to assess all, maybe neither to use it all, but the amount of knowledge, best practices, discussions among these webinars, France, Latin America, US, India, Asia, are really a treasure. Also, a hard work that is given in a very non-profit way. All are accessible, all are available to make things in each context, and that is fantastic. Congrats, Tom.
You're welcome. I know those regional meetings, coming back to those, and I appreciate the other acclaim. But, you know, they've been conducted in Spanish, and of course, our Brazilian friends have a lot of meetings, and we encourage them as well in Portuguese. But these regional meetings in Spanish with multi-countries involved, that's got to be an encouragement. I mean, I know I've seen, what, 20 to 50 people in these calls. It's got to be encouragement to you and the others, you know, in Latin America.
And just a few words about leadership, if you may allow me. Leadership in 21 cycle, leadership in COVID-19 requires a lot of courage, and courage based on knowledge, courage based on also the believing, real, honest believing that you are not up and others down, top and others not, stars and others nothing, but all of us are network. All of us have something to say, not want to talk, but to say, to exchange, discuss, like in Rome and China and US, or like us by webinar. All these extraordinary knowledge and best practices that we can discuss together as partners, equal, will be valuable in the next months and years. Thank you, Tom.
Yeah, Rossana, reminds me of a conversation that Luis Fernandez and I had with the Chilean public and private clinical engineering leaders, and who are trying to create a society in their own country. And we said, CED is about providing value, and that brings people together when we provide value in the programs that you've been talking about. Two last things, Rossana. One is, you've gotten a new role in CED. You're a part of this Hacking Coronavirus daily meeting and daily e-newsletter. Talk about that experience. So you're representing Latin America in a very important way there.
It was challenging when you think about what is the best, most valuable, pertinent, useful information, and how this information could be used for others, by others. It's challenging, but it's totally valuable. It is exciting, not just to research, but to research with meaningful, knowing that this information will be used and will be divulgated by others on time. I have not seen this kind of network before. Talking about the Hacking Coronavirus team, we are a member. Never before. It's effective, the discipline is high, but the results and outputs are very good quality as well. I am very honored to be part of that. And of course, it is not the only thing that is going to come from CED-IFMB, but certainly so far, we are making the difference in a good way.
Thank you, Rossana. And just a reminder to folks, the Hacking Coronavirus daily newsletter has been coming out for about 150 days as of Global CE Day. It represents daily work by a team, and Rossana has joined that team, and we're very delighted about that. So Rossana, in closing, you know, Global CE Day, what does it mean to you?
It's the best date to remind all the efforts done in the past, all the achievements and results not expected as we thought before, but what the lessons are. It's time to celebrate. Each time you are part of a round table, each time you are not, but your voice can be represented to make a change. It's a very special day to celebrate what is valuable, the well-being of the population, the improvement of health of vulnerable people and all the population in general, and what kind of contribution you are able to do, not just in your country, but with other countries.
Rossana, thank you so much for your time today.
Thank you, Tom.